The health service is coping, but only just. At Milton Keynes Hospital, 2/3 of the beds contain someone suffering from COVID. And today, ambulances queued outside London's A&Es, unable to unload their patients. The pressure that has been building for weeks is now becoming unbearable.
We're going to reach a point where we simply don't have any physical intensive care beds for the sickest patients, but we don't have any ward beds for the ill patients. Doctors aren't prone to melodrama and hyperbole, but it's frightening. It is frightening. We're already stretched to breaking point, and the very thought that this could get a lot worse is something that we're trying not to think about right now.
In just 1 week, the number of patients in hospital with COVID-19 has shot up by 6,500 to reach a UK total of more than 30,000, well past April's peak pressure on the NHS. The hospitals closest to being overwhelmed are in London. An internal briefing leaked to the Health Service Journal predicting there'll be 1,900 beds short of what is needed in just 12 days' time.
It's absolutely vital that people follow the lockdown rules so that we can get the cases down, so that we can protect the NHS and save lives.
The threat to hospitals comes as the NHS also strains every sinew to ramp up the vaccine rollout. Today, GPs were due to receive their first deliveries of the Oxford AstraZeneca version, but clearly there are teething troubles.
You can't book even in 12 weeks' time.
The surgery selected for the Health Secretary to visit hadn't got its delivery, and many GPs report getting little notice of when supplies are arriving.
It's just more frustrating than a concern because we've got capacity to vaccinate, and if we had a regular supply, we do have the capacity to vaccinate 3,000 to 4,000 patients a week.
The AstraZeneca jab does mean people can be vaccinated in their own homes and in residential care. 100-year-old Nell Prosser was among the first today. But even if the rollout rapidly accelerates, it can't prevent what many fear is a looming catastrophe for hospital care. Catherine Jones, 5 News.